Most people assume dizziness after 60 is just age. The truth is that four very common, yet often overlooked, causes make balance feel unreliable, and each one has simple fixes you can start this week. Understanding them matters because steadier balance means safer stairs, fewer close calls on curbs, and more confidence planning errands, walks, and time with family without worrying about a sudden spell. Here is the plain language plan you will get today. You will learn how to tell different kinds of dizziness apart in everyday terms, how to check one blood pressure pattern at home, which numbers actually matter, and a three-step action mini plan you can do safely without special equipment. You will also hear which symptoms are benign versus which ones mean it is time to call a clinician. Stay to the end for a 20-second self-check you can do in your hallway, and the single most overlooked fix that helps many seniors stop after meal wobbliness. No scare tactics, just what large studies tend to support, what they do not, and when to talk with your doctor or pharmacist so your plan fits your medications and medical history. If you are new here, I am glad you found us. This is a calm, judgment-free space for women and men in their 60s, 70s, and beyond who want clear, doable health guidance. If you value practical, step-by-step explanations, consider subscribing and share in the comments what kind of dizziness you notice most: spinning, lightheadedness, or a boat deck sway. Before we walk through the four causes, a quick map of words you will hear. Vertigo feels like the room is spinning. Lightheadedness feels like you might faint. Imbalance feels wobbly, as if your legs and the floor are not agreeing. They often point to different roots. This simple language helps you and your clinician match the fix to the cause rather than chasing random tips that do not fit your situation. First, dehydration and stand-up drops in blood pressure, called orthostatic hypotension. Why this matters: when you stand, blood briefly falls toward your legs. Healthy nerves and blood vessels tighten, and your heart speeds up to keep brain blood flow steady. After 60, those reflexes can be slower, and common medications, like diuretics for blood pressure, certain prostate medications, and some antidepressants, can add to the drop. The result is that telltale, floaty feeling when you rise from bed or get up from a chair, especially in the morning. Here is an easy scenario you may recognize. You wake, rise quickly, take a few steps, and need to grab the dresser. It eases in 10 to 20 seconds, then you feel fine. That pattern often points to a stand-up blood pressure drop, rather than something like a stroke or an inner ear attack. The jargon is not helpful, so think of it this way. Your pressure stabilizer is slow on the pickup, and a few tweaks can speed it up. What you can do this week: first, hydrate on purpose. Many seniors feel less thirst, so aim for around 6 to 8 cups of fluids daily unless your clinician has you restricting fluids. Plain water works, so do herbal teas and broths. If your doctor has not limited sodium and you do not have heart failure or advanced kidney disease, a small dose of salt with food can support pressure stability. Many people do fine targeting 2 to 3 grams of sodium per day from food rather than ultra-low levels that leave them sluggish. Ask your clinician what is right for you. Second, stand in 2 gears. Sit at the edge of the bed, pump your ankles 10 times, then stand and pause for 5 to 10 seconds before walking. That tiny pause gives your pressure stabilizer time to kick in. Third, consider light compression socks. 15 to 20 millimeters of mercury is a common, comfortable range to reduce blood pooling in the lower legs. A useful home check is the sit-to-stand blood pressure test once or twice a week. After resting 5 minutes, take your pressure sitting. Then stand and retake it at 1 minute and 3 minutes. A drop of 20 millimeters of mercury or more on the top number, systolic, or 10 on the bottom number, diastolic, suggests orthostatic hypotension. If you see those numbers often, share them with your clinician. They may adjust one medication timing, dose, or type, which for many people makes a bigger difference than any supplement. A quick safety note: if standing causes severe chest pain, new severe shortness of breath, a fainting event, or if the dizziness does not improve within a minute, seek care. For most mild cases, the steps above reduce the morning wobble noticeably within 2 weeks. Second, inner ear crystal shifts, BPPV, or benign paroxysmal positional vertigo. Why this matters: inside your inner ear, tiny calcium crystals help your brain sense head movement. With age or after a minor bump, a few crystals can slip into the wrong part of the balance canal. When you roll in bed, look up, or tie a shoe, the canal gets the wrong "we are spinning" message, and the room briefly whirls. The pattern here is distinct: short, intense spinning, often less than a minute, triggered by a position change, with normal hearing and no weakness or slurred speech. You may feel a wave of nausea, but between episodes you are okay. Many seniors live with this for months, thinking it is part of aging, even though a simple sequence of head movements can reset the crystals. What helps? A trained clinician or physical therapist can perform a canalith repositioning sequence, often the Epley maneuver. It takes a few minutes and often brings relief within a day or two. You can find home guides, but I recommend doing the first reset with a clinician to confirm which ear and canal are involved. Doing the wrong sequence is frustrating and prolongs the symptoms. For the next week, sleep with 1 or 2 extra pillows and try not to lie on the affected side. Get up a little slower and pause when you roll to a new position. If you feel queasy, ginger tea or small, frequent sips of fluid can help you stay hydrated without upsetting your stomach. Red flags that mean get checked urgently include vertigo with double vision, severe headache unlike your usual, new trouble speaking, one-sided weakness, or hearing loss in one ear. Those can signal something more serious and are not typical for BPPV. A brief myth bust here, because it saves many people months of suffering. Dizziness is always from low iron. Not true. Iron deficiency anemia can cause fatigue and exertional lightheadedness, but classic spinning with bed turns points more strongly to inner ear crystals. It is always the brain. Also not true. While stroke warning signs should never be ignored, most short, position-triggered spins in an otherwise well person are inner ear, not brain. Matching the pattern to the cause gets you to the right fix sooner. Third, vision and footwear, especially multifocal lenses on stairs. Why this matters: balance is a team project between your inner ears, your joints and muscles, and your eyes. After 60, contrast sensitivity can drop, cataracts can scatter light, and bifocal or progressive lenses make near vision clear at the expense of distorting the ground in your lower field. That means when you step off a curb or onto stairs, the bottom of your glasses may tell your brain the step is closer or farther than it really is. The result is that the ground moved feeling, even though your ears are fine. Here is a scenario many people recognize the day they first try to fix it. You bend your head down to look through the top part of your lenses on the stairs. That helps for a moment, but strains your neck and throws off your inner ear-neck teamwork, which can create its own wobble later. Here is what helps this week. If you wear progressives or bifocals, ask your optometrist about a simple pair of single vision distance glasses for walking outdoors and on stairs. They are a low-tech, high-impact fix for many. Add more light, not harsh light, but steady, even light. Replace dim hallway bulbs. Use warm, low-glare night lights that illuminate the path from bed to bathroom. High-contrast strips on stair edges make depth easier to judge. Footwear matters as much as lenses. Shoes should be low-heeled, snug at the heel, with a firm heel counter and a sole that bends at the ball of the foot but does not twist like a dishcloth. Avoid overly cushioned, loose slip-ons that let your foot wobble inside. If you use a cane, have a physical therapist check the height. The handle should line up with the crease of your wrist when your arm hangs at your side. Small adjustments change how centered you feel. A quick red flag reminder: sudden vision loss in one eye, new double vision, or a curtain-like shadow needs urgent care. For the rest, a yearly eye exam and a walking pair of glasses reduce many mystery near falls within days. If this is helpful, tap subscribe so you do not miss the next step. We build on this in upcoming videos. Fourth, and this is the most overlooked pattern I see: after meal blood pressure drops and blood sugar swings. Why this matters: after you eat, blood flow shifts toward your digestive system. In younger years, your vessels and heart adjust to keep brain blood flow constant. After 60, or with long-standing high blood pressure, diabetes, Parkinson's, or certain blood pressure medications, those adjustments can lag. Your top blood pressure number may fall by 20 points or more within 2 hours after a meal. The result is that foggy, wobbly, sleepy spell after lunch that is not just a food coma. It is a real circulation dip. You can spot the pattern. Mornings feel okay. Midday errands feel risky. You stand from the table and feel unsteady, then improve in 10 to 15 minutes. Large, high-carbohydrate meals make it worse. Add a beer or glass of wine, and it multiplies. That is postprandial hypotension, and it is astonishingly common, yet rarely discussed in routine visits unless you bring it up. Here is the good news: a few meal timing and composition changes often help within a week. First, shrink and space meals. 3 smaller meals and a protein-rich snack instead of 2 big plates reduce the blood flow surge to the gut. Second, lower fast carb spikes at lunch. Build your plate around protein and fiber: chicken, fish, beans, eggs, or tofu paired with vegetables and a modest portion of whole grain. Think half-plate veggies, a palm-sized protein, and a fist-sized starch. Third, drink a full glass of water, about 12 to 16 ounces, about 15 minutes before meals. This simple step can support blood pressure stability during digestion for many people. A short walk after eating, even 5 to 10 minutes around your home, helps your muscles pull sugar out of the blood more steadily and supports circulation back to the heart. If you use insulin or certain diabetes pills, coordinate any changes with your clinician because smaller, lower-carb meals and walks can change your dose needs. A valuable home experiment is the lunch check. Take your blood pressure before lunch, then again 30 and 60 minutes after. If you see consistent drops of 20 points or more on the top number after eating, note what was on the plate and bring those logs to your clinician. Small medication timing changes, such as taking a blood pressure pill at bedtime instead of midday, may be appropriate. Do not move medications on your own. The pattern gives your clinician something precise to respond to. Another common contributor to swinging dizziness is low B12 or iron, especially if you follow a low-meat diet, take metformin, or have had stomach surgery. The clue is lightheadedness and fatigue on exertion rather than sudden spins. A simple blood test can check both. If low, food and supplement plans are straightforward and effective. Again, the point is not to guess, but to match the fix to the pattern you observe at home. Let us make this practical with a 3-step action mini plan you can start today. 1. Map your pattern for 1 week. On 2 mornings and 2 mid-afternoons, do the sit-to-stand blood pressure check, sitting after 5 minutes of rest, then standing at 1 and 3 minutes. On 2 lunch days, add the lunch check, before, then 30 and 60 minutes after you eat. Jot down how you felt and what you ate. This takes 5 minutes and replaces guesswork with a clear picture. 2. Change one thing at a time for 7 days. Start with the easiest and safest: fluid intake. Add 1 to 2 cups of fluids spread through the day and the pre-meal glass. If your clinician has you on fluid or sodium limits, follow those instructions exactly. If mornings are your worst time, add the ankle pumps and a 10-second pause before walking. If after lunch is worst, split that meal in two and walk for 5 minutes afterward. 3. Review your medications with your pharmacist. Ask specifically about drugs that can lower standing blood pressure or cause dizziness. Diuretics, alpha blockers, nitrates, sedatives, some antidepressants, and drugs with strong anticholinergic effects. You are not asking anyone to stop a needed drug on the spot. You are gathering information to bring to your prescriber about safer timing, dose, or alternatives. A few practical tips round out the plan. If your dizziness is worst when you roll in bed or look up, ask your clinician about BPPV and a vestibular therapy referral. If it is worst on stairs or outdoors, try single vision distance lenses for walking and improve lighting before you assume something mysterious is wrong. If it is worst when you stand quickly from a chair, think hydration, ankle pumps, and compression socks. If it is worst after larger meals, think smaller plates, steadier carbs, and the pre-meal water. Here is a final set of do not panic frames that calm the mind and help you act. Brief, position-triggered spins that resolve in under a minute and recur with the same triggers are usually benign and fixable with a crystal reset. Morning lightheadedness that fades in under a minute often reflects a manageable stand-up pressure drop. Feeling unsteady after a large, fast-carb meal points to the fixable after-meal pattern we discussed. Red flags to act on immediately include a new severe headache, slurred speech, weakness on one side, chest pain, blacking out, double vision, or ongoing spinning that does not ease. Those are rare but important. It is okay to seek care and be told it is benign. It is not okay to ignore a stroke pattern because you saw a video on inner ear crystals. You deserve both confidence and safety. Let us close with that promised 20-second self-check you can do in your hallway. Make sure a family member is nearby the first time if you have had a fall recently. Stand tall with your normal shoes on and your walking glasses if you use them. Look straight ahead, pick a point on the wall, and start walking at your normal pace. After 5 steps, turn your head slowly side to side as if saying no, while you continue to walk for 5 to 10 more steps. Notice whether that head turn makes you feel unsteady. If it does, your balance system may be relying heavily on vision and less on inner ear and leg feedback. Vestibular or gait therapy can help rebuild that teamwork in a few weeks. Now do a safe stand-up check. Sit at the edge of a firm chair. Pump your ankles 10 times. Stand up. Pause with your hand on the chair back for 10 seconds. Then take 2 steps. If pausing removes the lightheaded feeling, that points back to the stand-up pressure drop pattern, which is very responsive to the hydration, compression, and medication timing steps we covered. Here is how the week can look when you put it together. On day 1, start a simple dizziness log and do your first sit-to-stand checks. On day 2, add the pre-meal water and split your largest meal. On day 3, switch to your walking glasses and add a night light to your bathroom path. On day 4, call your pharmacist for a medication review appointment or bring your list to the pharmacy window. On day 5, ask your clinician about vestibular therapy if your dizziness is position triggered. By day 7, repeat your sit-to-stand and lunge checks. Most people notice either fewer morning wobbles, fewer after-meal dips, or both. Consistency wins here, not perfection. Small changes in timing, fluids, and lenses add up to steadier legs and a clearer head. The payoff is practical. You feel safer getting out of bed, more confident on stairs, and less nervous about leaving a restaurant table. That confidence is what independence feels like. I will link plain language resources in the description so you can review these steps at your own pace and take notes for your next appointment. Before we sign off, share in the comments which pattern sounded most like yours. Stand-up lightheadedness, position-triggered spins, stare wobbliness with multifocals, or after-meal dips. Your note will help someone else recognize their pattern. If this helped you feel more in control of your balance, please like the video, subscribe, and pass it along to a friend who might be avoiding certain outings because of dizziness. Next time, we will talk about simple strength and ankle moves that make every step feel more secure. Stay steady and take good care.